So yeah, the reason I want to work with you is because I think you have some more core issues. Did you ever get an injury in your back or something like that?
I had 2 injuries. Concussion fracture here.
In all 5?
Mm-hmm. When I was a kid, I had a lot of that. Sprained my ankle and took me pretty quick. No x-rays of it. And then several years ago, I was in an automobile accident. My left side was strained, neck, and
Lumbar?
yes. Just talking to me this morning.
Okay. So from that intake, I'm looking at the lumbar spine, the left sacroiliac joint, and the neck might be a little bit too much to do today. But, you know, if we get the lumbar spine more fluid, maybe the neck will feel better. So, okay. Well, let's have you face down. Okay, so after a brief intake, right? So after I look at my clients' forms that they bring in and talk to them, observe them, I'll get them talking about a back injury. I'm going to put them prone on the table so I can do some palpation assessment and warm the tissues up a little bit, right? And I'm going to stick kind of between here for now, right? So right there, the erector's right there, the lumbar, both sides. Goes up into the lower thoracic on the right side. Okay, so I'm just cataloging now. So I'm looking at, well, these muscles may be compensators. All right, so the next thing I'll do is I could do some muscle testing while they're prone to get an idea. I often like to do hip flexor tests just to make sure the hip flexors are working, because through the hip flexors I can do some of the core testing. So let's have you hold your left leg down to the table. Press down. Good, relax. Press down. So we will go through these tests today. Good. Hold your left leg down. Good. And press down. Good. Okay, that's quick. That's not as much as I would normally do, but I do want to move a little faster. And hold both legs together down to the table. Good. Okay. Remember that test from yesterday. Okay. And I can do pelvic rotation tests while they're prone. Measure my pressure here. Good. And in this range, press. Good. And in this range, press. Okay. So, I'll see, I did a number of muscle tests, right? And get right to it, whatever it is. But right here, in this eccentric range, press here, it's off. So, that initiates motor learning, because rather than having a successful and easy response to my testing pressure, the muscles kept lengthening, kept going that way instead of holding, right? So that's when motor control says, well, just now I didn't get the results I expected. How do I do this then? That initiates motor learning. So I did a little release, measure my pressure, and now the test has a much clearer, cleaner response, right? So motor center, because we engage motor learning, motor control can now say, you know, what I just did was easier than what I did just a few moments ago. Okay, I got this and I got this. Okay, I like this. What I just did, I want to save this. I want to remember this. So I'm going to encode this and recompile this and put it back on my hard drive in motor memory, so that I can remember how to do it this way, because it was easier. And in that, we just changed motor memory. So now they remember how to move differently than they did just a minute or two ago. All right? So when you're dealing with a complex, long-standing injury, each piece you put back in enables motor control to take the next step. Good, okay. And match my pressure this way. Good. And here. Good. And again. Good. All right. Let's have you sit up on the edge of the table. So usually my progression would be from lying on the table to sitting to standing, right? Because this is where life happens. It doesn't happen here. Okay, so let's do some sitting tests. And match my pressure here. And here. Good. And here. And here I gotta move a little faster. If this was a full treatment, I'd be doing a lot more testing, right? But this is class. Okay, so I'm gonna move quickly to this and match my pressure. Good. And match my pressure. Good. And again. All right, good. See, the work you two did together yesterday. It's evidence that when you engage the motor learning process properly, motor control will remember the next day. Right? Okay, good. So I'm still thinking about that tension in the lower back. Match my pressure. Good. And here. Press to the side here. All right. These tests are in the manual. Move this way. I'm going to get some isolation on the internal oblique, of the right internal oblique. Match my pressure. Good. And on the right external oblique, match my pressure. Good. Okay. Excellent. Well, let's have you standing. Good. Okay. So when your client stands up, you want to look for a good neutral stance. And that means that the ankles, if you draw from the nice point here on the ASIS, if you draw a plumb line, it'll bisect, ideally it'll bisect the knee and the ankle joints, right? And then the toes will be in front of the heels. The more the toes are lateral to the heels, the more likely they are to be using the piriformis or one of the other deep lateral rotators, which we will discuss today. Okay? Especially if you're working with ballet dancers. When you start living life through first position, you're walking turned out. Right? Well, what's going to turn you out the best? Your lateral hip rotators, right? And that's fine for ballet, and we're working with active ballet dancers, we have to consider what they're doing and work within what they need. But for those of us who are ex-ballet dancers, we don't need to do that anymore, so in that case, we want to work with them to help restore a more functioning gait and posture. Right? Okay, so what do we see? The rib cage is a little forward. Not too bad though. You see that the ear lines up pretty close to the shoulder, right? So it's pretty good alignment along the coronal plane. Okay? There's just little nuances that indicate to me that there's tension here, which we already know because we palpated. But you're asking about what do you see the difference between sitting and standing. This is a case where it showed up. It becomes more apparent when Anna stands up, right? So what that's telling me is that motor control is saying I need to do something a little different when I'm standing in gravity to be as stable as possible, okay? So I'm going to come back real quick and I'm going to palpate. I feel a little more tension on the left side. So I'm going to start left side. And match my pressure here. Good, okay. Match my pressure here. All right, there we are. And you see I stopped real quick, right? Oh, the table's right here. But I stopped real quick. I don't want to push anybody over. A little quick release. Match my pressure. Good. And arm up again, press to the side. See there, it shows up a little bit. Okay, again, the response wasn't real clear. Motor control center says I'm not so sure about that. What do I need to do to make that better? Engage is motor learning. I release real quick, match my pressure. Retest. Motor control says, well, that felt easier. I want to remember how to do it this way. All right. So what's happened is Ian's motor controls decided to stabilize the left side. In gravity, the erector spinae here needs to be tighter. It needs to work harder. Right? Let's say it's because of the injury. Right? So the injury means everything gets scrambled. Motor control then has to scramble in response to try and assemble a new pattern to help be stable in gravity. Right? So what we just taught was motor control is that, well, okay, we have all the other muscles here running all the way from the side of the head to the outside of the foot, and I have this whole team. So if I don't use this one so much, I can distribute that workload to everybody. And when everybody's working, of course, it's easier. All right. Turn around and face the table. And arm up and press back. Good. Okay. All right, now turn around and face away from the table again. And give you a little extra credit homework here. Arms up again. There's my pressure. All right, now, here it comes. I want you to just gently engage, pull your belly button in towards your spinal. Just a little. Good. Keeping that engaged. Match my pressure again. And now it's off. Next step is I want to improve motor control's ability to engage the abdominal wall just a little bit better, right? Okay, belly button slightly in. There you go, arms up, match my pressure. All right. Okay, so what I just did was I changed the parameters slightly. Before I was just allowing the abdominal wall to just be where it is, and that was pretty stable. But when we engage the transverse abdominis and the internal obliques a little more, by pulling the belly button in slightly, it became a positive testing unit, right? So what that says is motor control was fine, but motor control doesn't quite get how to use the complete abdominal wall as part of standing posture, right? So by having the client pull their belly button in slightly, kind of that, you ever see the comic books, the Superman hero, that stance, right? The whole point is, like I said yesterday, is to help motor control improve its ability to use all of the core muscles to stabilize, to create a stable, functioning, easy movement platform in gravity. Right? And the abdominal wall is a crucial part of that, just as much as our back muscles are. Right? So that's a way to help them take that step in that direction to gain a little more control, a little more, and get up the abdominal wall and get that to participate a little more in posture.